Looking at barriers to contraceptive use for young women in developing countries. Contraception barriers cause increased mortality, morbidity, unsafe abortions, and sexually transmitted infections in young women. Pregnancy and birth complications are the leading cause of death in women aged 15 to 19 in developing countries, an age group that also experiences 18,000 deaths due to unsafe abortions each year. In developing countries, 222 million young women have an unmet need for contraception, where unmet need is the percentage of women having unprotected sex but not wishing to fall pregnant. It is estimated that 20% of pregnancy and 90% of abortion-related morbidity and mortality, as well as 32% of maternal deaths, could be avoided with effective contraception use. A qualitative systematic review by Lisa Williamson examined the research question of what barriers prevent young women from accessing or using modern contraception in developing countries. A systematic review is an open process that involves analysing and summarising studies related to a specific research question, where the studies use qualitative methods such as observations or interviews in order to gather their data. The final 7 studies used in the review were across several developing countries in Africa and Southeast Asia and included in total 387 young women, who were either interviewed or a part of focus group discussions that aim to find similar patterns or themes of contraception barriers. The results identified many barriers young women face in regards to contraception use, and all these barriers fell within 3 main categories. The first one was barriers to obtaining contraception, which included things such as cost, laws and policies, uncooperative health workers, limited selection of contraceptive devices, sporadic contraceptive stocks, and physical distance to obtain contraception. The second category was barriers to using contraception. This included things such as social pressure, stigma, misconceptions of side effects, inadequate education, and having a coercive, manipulative, or violent sexual partner. The third category was barriers to consistently using contraception, which included sporadic or infrequent sex and the fact that adolescents are more likely to discontinue contraception use than older women. Limitations of the study included the limited geographical area, which was covered by the review, the lack of comparable research in this field, and the small number of papers used by the review. Whilst young women's unmet need for contraception has improved by 2.1% from the early 1990s to 2016, there remains many barriers to contraception use. The World Bank believes family planning and contraception use to be an extremely cost-effective public health intervention, as access to contraception has far-reaching health benefits that go beyond maternal health, such as poverty reduction. Overcoming barriers to contraception in these countries requires a multifactorial approach that is distributed throughout all levels of society in the same way that these barriers are distributed throughout all levels of society.